If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
Okay, welcome everyone to Health Further. I'm Vic. Unfortunately, Marcus got the flu late last night or early this morning, so he is struggling and not feeling at all well. So I'll be driving solo today. Wish him the best. I'm glad that I don't have the flu. It sounds like a rough year for the flu. Hopefully Marcus will be back. He'll definitely be back by next week. It's just me today. I have selected 8 stories. I sort of cut back a little bit because there won't be so much back and forth, but there are a few stories that I think are worth covering. A little bit shorter show probably today, but it'll be good to cover a couple stories, and then we'll be back next week with a full show. So with that, let's dig in. Okay, in the economy that we always cover, it's been a wild week in the stock market, really related to Trump and the whole Greenland complexity. On Tuesday, I think it was, Trump was threatening significant tariffs to take Greenland or get a deal with Greenland, and even talking about the possibility of, using the military forces. So Tuesday, the stock market was down dramatically, pretty significant crash. But then Trump went to Davos, and on Wednesday it came back. Sort of round-tripped, a little bit of a crisis midweek, and then it came pretty much all the way back. So we're continuing the volatility. I think that's going to be the status quo for the foreseeable future. Seems like it's, both up and down. So I think at least for this week, things are okay. We'll see how it evolves. There was a good story about inflation. So the Wall Street Journal had an article. Title is 2025 inflation numbers are finally in. Here's the good and bad news. And they really broke down each component part of inflation for the 2025 year. If you're watching on YouTube, which you should, I think it's much more valuable than just hearing the audio, but I'll talk you through the chart here. There's a really good chart about consumer prices, how they changed during 2025 by various components of CPI. So of course, overall CPI is a blending of the basket of all these goods. For the year, that was 2.7%. Pretty good overall inflation. Of course, not at the 2% that the Fed's trying to hit, but pretty good compared to where we have been over the past several years. But then when you look at the component parts, online subscription like streaming, Netflix, HBO, those kind of things, was up 29%. So significant inflation there. Coffee, beef, both over 15%, coffee almost at 20%. But then eggs and gasoline were down. And so different component parts were changed at different rates. And the article talks about the impact on people's actual day-to-day purchasing power is quite different based on where you are in the income strata. So obviously, if you are buying groceries and buying coffee and beef and your income's not growing that quickly, inflation still is pretty impactful. I think it's going to be impactful for several years. But at the same time, it feels a lot better today at 2.7 than in past years where it was much higher. So that's the economic story for this week. We don't have any venture deals. There were a few deals, but nothing that exciting. So I'm going to jump right to policy. There were a couple policy stories to touch on. In Feirce Healthcare, story today, House passes health funding package, including PBM reform. So the House, of course, it has to go to the Senate as well, but the House passed a appropriations package for Department of Health and Human Services, passed, with a good margin, 341 to 88. And importantly, of course, it funded HHS, which is important, but it also put in a clause preventing PBMs from tying compensation to the list price of drugs, trying to boost transparency for employers and consumers. So I think that seems positive. We'll have to see the details. There wasn't a lot of detail that I could get from the article that just came out tonight at 5:00. But it seems like good progress on the financing front for the government. Have to go to the Senate now. Also valuable, telehealth and hospital at home are in the House as well, being discussed. It hasn't passed yet, but being discussed to be put on a multi-year extension. So if you recall, the telehealth and hospital at home, but certainly telehealth has been in this sort of interim a little bit of 6 months here, 12 months here extensions, and it would be great to get a multi-year extension. You should give people certainty about what is telehealth, what is hospital at home going to be reimbursed at. And so that's really positive. We'll see how if it gets passed, but they are talking about extending these for several years. And then, of course, the Senate will be another matter to take up as well. Really interesting new approach from ARPA-H, which, of course, is the Advanced Research Projects Agency for Health, similar to the DARPA defense project. It's really meant to drive innovation, drive research around focused areas. The Trump administration came out really calling for new AI agentic assistance, specifically to help with cardiac care, cardiovascular care transformation, they're calling it. And they're calling for proposals to be submitted. There's grants involved, and around cardiology, tying wearables, data, sort of everything that a cardiologist could do over the phone. ARPA-H wants to see proposals of how we could embed that into an AI agent that could sort of take your data and give you appropriate advice. Pretty interesting. We'll see what comes of it, but pretty exciting to see the Trump administration leaning in and trying to pull innovation. Several companies that I'm aware of might be interested in applying. I think it'll be great to see, what can American entrepreneurs do to really combat heart disease. It's a personal passion project of mine, of course, and great to see the Trump administration trying to pull in innovators from around the country to help with cardiac disease. Jumping to the payer community, UnitedHealthcare has been on a campaign to try to improve their customer relations, government relations, and Steve Hemsley, who's the current CEO, was CEO for a long time. Chairman, just came back to be CEO last year. He was in front of the House Energy and Commerce Committee on Thursday and said in there that they were going to give back profits from their individual ACA plans, distribute them back to members. And so they have a small footprint of ACA individual plans, but that's pretty interesting and certainly welcomed that they sort of, if they have significant profits, that they would eliminate and then rebate the profits for the year when it occurred. So we'll have to see the details, but again, I think pretty interesting, and certainly Hemsley and overall United, they are trying to turn the public opinion of United positive, and certainly refunding profits back to members is a good way to start there. They have been in the penalty box or in, being attacked pretty broadly over the last year and a half. But this is certainly a step in the right direction. The last few weeks have been a few initiatives that have come out, and I think we'll continue to see that over time. Okay, and then in the Web3 arena, New York Stock Exchange is launching a always-on 24/7 trading platform to put securities on the blockchain, tokenizing securities, which would then allow them to trade over the weekends and nights 24/7. Pretty interesting. I think there's a lot of complexity in this, but of course, NYSE is the huge 800-pound gorilla in the space, 233 years old. So, really old, established, traditional Wall Street platform. And for them to go to tokenization is pretty interesting. There's a lot of questions of how do you bring together the tokenized trading that's going on 24/7 and then connect it to the traditional securities markets. But NYSE is certainly in a good position to do that. So not a lot of detail of when it will roll out, but I think it's pretty interesting and it's certainly coming. We're going to see a lot of tokenization of assets, existing stocks, where if you want to buy shares of Google at midnight, you can do that, and it's on this tokenized exchange. And then there needs to be some sort of reconciliation process so that it all settles correctly. But certainly, New York Stock Exchange is a huge player and a good side. I think the Web3 momentum is continuing this year. We probably are going to get legislation that sort of defines how the market is structured. What is the CFTC going to regulate? What's SEC going to regulate? I think that's going to come mid-year probably. And I think a lot of Wall Street, including the New York Stock Exchange, is sort of getting ready for that. And then jumping into AI, there are two AI stories that I thought were worth mentioning. Amazon launched their health AI chatbot for One Medical members. So over the last couple of weeks, we've seen the big tech companies, first it was OpenAI, then Anthropic, come out with dedicated health products. And now Amazon is launching that on their One Medical platform. Article in Healthcare Dive, sort of talking about it, and it shows a pretty good image of what it's going to look like. It uses the One Medical's members' medical record and then all of the, LLM knowledge base intelligence in order to provide healthcare coaching, healthcare guidance. It says that there are multiple safety guardrails. I don't exactly know what that means, but this is coming. It's going to be everywhere. I think we already are seeing AI kind of embedded now in all the healthcare, embedded in all the AI products, and I think we're going to see more and more of that. So I guess it's positive. I think we'll see what the quality is, but certainly could be really helpful to get people the information, help them with navigation, answer questions, ideally with a doctor still in the loop, sort of clarifying things, or maybe still for true diagnosis, but then the AI could really help with filling in questions and maybe helping you understand what to ask when you see the doctor next. So Amazon launched that yesterday. So that was pretty interesting. And then the last story I'll cover, Wall Street Journal covering a pretty interesting survey where CEOs and C-suite members really see an answer in terms of AI as being really impactful, saving them a lot of time, making them much more productive, whereas the workers in those same companies do not see the benefit. And so you have a pretty big disconnect between what the leadership is seeing and what the actual day-to-day employees are seeing. And I wanted to talk about that. I'll probably talk about it with Marcus next week. We could have some back and forth. But in the story, they talk about a survey. It's called a section survey. And there were 5,000 white-collar workers with 1,000 people or more in the company that were surveyed all fall, basically from September through November. So it's a couple months old. And the workers, about 40% said that they were not saving any time at all during the week. And in the C-suite, only 2% said they were not really getting much benefit. And then on the other extreme, the workers, only 2%, saw really more than 12 hours of benefit per week, that is. So that would be a significant improvement in productivity. It's a 40-hour week. So getting 12 more hours of productivity, saving that time, huge impact, almost 25%, a little more than 25%. And so that is kind of a high bar. So workers, there was only 2% that thought they were really getting that kind of impact, and then another 3%, 8 to 12 hours. So really 5% getting an impactful, significant benefit on their time. Whereas a C-suite, very different. 19%, almost a fifth of the survey responders were getting more than 12 hours of productivity time savings every week. And then another 24% getting that 8 to 12 thing. So really an incredible difference in perception of how AI is driving productivity. And I don't know, I'm going to talk to Marcus. I just am trying to think about how that could be. They're basically the same products. And I have two hypotheses, and we're going to keep researching and talking about it. But I'll send out to you just for thought, proposal, that it might be that the leadership has a better perspective and can see the ways in which they could sort of pull in AI to help with various pieces and parts. And maybe they don't have to wait for an analytics group to come back with a report, or they don't have to have someone else in the organization go do research for them. And they can get more done just quickly by using the AI tools. That's one hypothesis. where the workers maybe don't have that perspective. They don't have that view of all the different things that need to be done and the resources to pull from different areas using AI. They'd be maybe much more like assigned, we want you to do these tasks. So that's one thought that I am interested in pursuing. If you have any ideas or you think that is right or wrong, please comment, let me know. The other thought that I was sort of kicking around is that it might be that the motivation is different. And so the motivation for a line worker may not be to try to work really hard to find ways to do the same amount of work with less time. It's a little counterintuitive, but I think if you start to do your work too quickly, it may not really benefit you that much. Whereas in leadership, in the C-suite, it might be you have a lot of motivation because you're trying to achieve more things and you have a lot of benefit. Your comp is probably tied to more outcomes versus a worker that might be salary-based or hourly-based. So those are the two ideas that I had. There was really no reason given in the article. And so we're still learning about this space, but it seems like there is a dichotomy between sort of the benefits to individual workers versus C-suite. And we'll have to monitor that over time. So that is the 8 stories that I was going to cover. Thanks for joining. Kind of a slow, not that slow of a week, but with Marcus gone, I just picked out sort of the top stories, and we will be back next week and give you a much more in-depth dive into, we'll certainly talk about all the venture deals that have been going on, and then dig into more of the AI details as well. So thanks for tuning in. Sorry we don't have Marcus this week, but hope you have a good weekend, and we'll talk to you next week.